Colorectal cancer is the second most common form of cancer in the United States behind lung cancer. And fortunately, about 90% of it is preventable, and we have screening modalities such as colonoscopy to help us prevent the development of colorectal cancer. So then the question is, well, if it's 90% preventable, then why is it the second most common form of cancer? And the reason why is that we probably only screen about 50% of the population because there are barriers to screening. So some patients don't know that they should be screened. Some patients are afraid of the exam. They're afraid of the results. There are other barriers regarding cost and time away from work. Typically, we start screening people at the age of 50, but with a higher risk population, particularly patients with a first-degree relative, we like people to come in either 10 years earlier than when they were diagnosed or at age 40. All the same things that we recommend for overall health and heart health also we think help prevent colorectal cancer. So regular exercise, a high fiber, low fat diet, and avoiding a sort of a sedentary lifestyle. And there is some new information suggesting that a daily aspirin per day may help prevent polyp formation, and therefore, and polyps are the precursors to colorectal cancer. There are about 150,000 new cases diagnosed annually in the United States, and there are probably around 40 to 50,000 deaths. And again, the key to the whole thing is prevention. And we're fortunate that we have a screening exam, a colonoscopy, that can prevent the vast majority of cancers. But you have to have the test in order for it to be effective. It's actually relatively straightforward to go through. And a lot of people's fears are actually overcome once they've been through it. And most of our patients, the first question they ask when the colonoscopy is done is, when is it going to start? And then they become these disciples who go out and tell everybody that it's really not that big of a deal. Surgery has evolved also with time. We've actually moved to what we call a single incision laparoscopic surgery, or single port surgery, where instead of having multiple trocars spread throughout the abdomen, we actually insert all the trocars through that one small incision. And we think that there are potential benefits with this approach from a pain perspective and particularly from a cosmetic perspective as well. We know through multiple studies now that there's less pain after laparoscopy, there's less time in the hospital, there are fewer hernia complications, and patients really get back to their normal activities a lot faster than after a traditional open surgery. One of the reasons why I enjoy helping patients and taking care of patients with colorectal cancer is that it's very curable. Even though we're surgeons and we operate on people who come in with these problems, we'd much rather prevent it.